so excited coming from northern Nigeria. Aysha, and I'm sorry, I wanted to ask you in the beginning to how do you say your middle name? Is it Abdulkadir?
Yes, you pronounced it right.
Abdulkadir Haruna, is that right? Haruna is a health economist working with Humanity Connect initiative and volunteering with Voice of the Girl Child and Vulnerable People Foundation. She is currently living and working remotely in Kano, Nigeria. Aysha likes attending webinars in order to gain new inspiration and inspire others. And she is team-oriented with proven ability to create positive rapport with people. She is fluent in English and Hausa. And she speaks a little bit of Arabic and French. And she has a Bachelor of Science in Microbiology and a Master of Science in Health Economics, all from Bayero University in Kano, Nigeria. Very much looking forward to your talk. Please get started. Am I saying your name right, Aysha? Right? Is Aysha? Am I saying it right?
Yes, you've said it right.
Okay, thank you. Okay, excellent. Okay, thank you. Well, let's looking forward to your talk. Oh, thank you so much. That's so thoughtful of you. Okay, I'm going to turn my camera off now so everybody can just focus on you, and I'm going to mute myself, okay? Okay, so yeah. So please start.
Okay, let me share my slides.
Yeah, share your screen. I'll keep on mute so I can start talk with you. Yeah, share your screen. That's excellent. Yeah. So you'll be sharing your screen for this? Aysha, are you I can't hear you. Are you starting?
I'm trying to share my slide.
Okay. Can you push share screen?
That's what I'm about to.
Okay.
Can you see my screen?
I cannot see your screen right now, Aysha. I see your picture with a heart on and then the pretty palm trees, but I don't know if that's I don't think I do see your screen.
Okay, let me try.
Thank you for the sandwich. Thank you for the sandwich. It's excellent. I do. I love avocado. Yeah. Right now okay. I'll unmute myself again. So, Aysha, if you can't share the screen, you could give your talk and we could hear the talk anyway. That would be okay.
Should I share my screen with you there, WhatsApp?
If you're having problems sharing the screen, you could still give the talk. Or if you want to, since I'm a host, I just emailed you. Do you want to email me your screen and see if I can if I can share it?
Yes, let's try it.
Okay, yeah, email to me. I just emailed you.
All right.
So just respond to my email. Do you see my email to you? do you see my email? Do you see my email? I just emailed to your Gmail. So just respond to my email and give it to me, and then I'll see if I can share it for you. And then you can just tell me when you want me to switch, and I'll do that. Like switch the slides. So yeah, so just email to me. Do you have my email? Did you get I sent you an email saying that I was ready in the practice room a few minutes ago.
Yes, I have your email address.
Okay. So just, yeah. So email me, and then I will put on your, I can try to show your presentation. So Aysha, just let me know when you've sent it, okay? And then I'll make sure to, yeah, I'm checking my email now. I have my email screen up, so I'm checking to see. Let me see, let me just push. Have you sent it yet?
Yes, I have.
Okay. To Shimo, okay, so I haven't gotten it yet. Do you see the email that I sent to you, Aysha?
I saw the email sent to me.
Yeah. If you see the email that I sent to you, maybe you could respond to that and resend it.
It's not your email address. It's a different email address.
Okay. I can only get something if you send it to my email address. Can you send it to my email address?
Personal email address, yes.
Okay. So I just sent you an email like about 10 minutes ago. Do you see that email?
Yes, I saw it. It's a different email address, not yours.
Okay. So mine is shimoca@plattsburgh.edu. Let me put it in the chat for you, because unless you send it to my email address, I can only see my email address. So let me just put that in the chat.
All right.
Okay. And then, but I did also, if you wanted just to respond, I did send you an email a few minutes ago about that the room was ready for you. But here you go. Do you see it in the chat now? Aysha, do you see? Yeah, do you see my email address? Okay, good. Okay, so yeah, send me yeah, so yeah, if you send it to that email address, I can see if I can share the screen if you're having problems sharing the screen, and then I can just click. You can just tell me when you want me to change the screen, and I can do that.
All right. I just shared it via the email address.
Okay, so you just sent it to my email address? Okay, let me see. Oh, good. Wait. All right, no, this isn't what that was another thing that I got. Okay. Oh, good, excellent. Okay, let me get it up. I think I have to download it. And then let me see if let me try to share this on my screen. Okay, let me see what I can. Okay, let me push share screen. This should be right up. It is. Okay, enable editing. I think okay. Oh yeah. So can you I think I have to enable edit it to this, which okay, now I've enabled edit. Okay. So can you see the screen now, Aysha?
No, not yet. Yes,
Okay.
I've started seeing the screen.
Okay,
yes.
excellent. So I'll push slideshow, and then I will mute myself, but just tell me when you want me to switch. Just say switch the slide when you want me to switch the slide, and I will do that. Wait, let me make sure I'm here with you. Okay, let me make sure. Okay, now I have to mute. I want to mute myself so I don't, if there's any conversation from me, we don't hear it. Not that I would talk, but it's just better. So I'd like to turn off my own video. Okay, I'm going to just stop sharing this for just a sec, and then I'm going to mute myself. So yeah, I'm already not on scene. I'm going to mute myself, and then I'm going to share this again. But Aysha, so you just tell me when you want me to switch. Just say go to the next slide, and I will. Okay. Okay?
All right. All right. Good evening, everyone. I'm Aysha Abdulkadir Haruna. I'm here to present a webinar on C-section and midwifery in Nigeria. In 2019, at the start of this year, the team from Nigeria Health Watch carrying out the Giving Birth in Nigeria project set out 3 states to understand the attitudes and opinions about cesarean sections in Nigeria. A cesarean section, C-section, refers to the operation of delivering a baby through incisions made in the mother's abdominal wall and uterus. We carried out focus group discussions with pregnant women, nursing mothers, and women who recently undergone C-section to talk about their opinions on the subject. Next slide. In-depth interviews were carried out with medical doctors, nurses, and midwives who explained their attitudes of women and their families to C-section. And finally, we took the streets of Lagos, Bayelsa, and Bauchi to hear what Nigerians thought about C-sections. Women perceptions of C-sections in Bauchi, Bayelsa, and Lagos. We had the story of Asma'u, a university graduate who was a housewife in Bauchi, and 19 other women. She was open to having C-sections because she said if it is the will of God, it is what it is. However, she said that she has to get her husband's blessing if it was what the doctor recommended. Asma'u's baby weighed 6 kilograms, and her doctors advised her to have C-section because her pelvis was narrow and it would be difficult for the baby to pass through. The decision lay solely with her husband, who pointed out that he was right and his mother didn't have to do C-section. So if his mother could, then his wife also could not need one. However, he only consented to the C-section at the hospital when he saw that Asma'u was tired of pushing and lost her breath. Unfortunately, this story ended with both Asma'u and her baby losing their lives. Next slide. So what you can see on the screen are the medical reasons that underlay factors a woman needs to have C-section. You can have a breech baby, a narrow pelvis, and lots more. So next slide. In Bayelsa, we spoke to 14 women. The norm seems to be that the relatives and society decides how a woman will give birth in her community. Many have spoken. Many have spoken that in their community, they rather do traditional birth attendants, so they are seen as Hebrew women of old. These traditional birth attendants are widely called massagers. Pregnant women seem to be largely influenced by their relatives and religious beliefs. They trust what their religious leaders tell them rather than what the hospital or doctors advise. From discussions with these women, we learned that most of them would rather have faith that they would give birth via vaginal delivery by using anointing oil given to them by their local religious leaders and praying well. They termed it normal delivery, perhaps indicating that to them, having a child by C-section is considered abnormal. Next slide, please. Some said they would rather use traditional birth attendants because they are cheaper than the hospital. The woman alluded to the fact that some hospitals, especially private ones, will say a woman needs a C-section because that was their means of making money. In Lagos, The majority of 12 women we spoke during the focus group discussions mentioned they would prefer to give birth at a government hospital as they felt they have more experienced midwives and doctors in the government hospitals than in private hospitals. Next slide, please. It was also widely believed that the government hospitals had better equipment and experienced medical professionals who would carry out C-sections than the private hospitals that were seen as being more expensive. However, one of the women said that her sister lost a child after having C-section in a government hospital. After that experience, she opted to have her second child in private hospital because in her words, they take better care of patients. From these conversations, we deduced the most of the women we spoke were aware of what C-section is. They were very much aware of what C-section is. They gave various scenarios that will determine why a woman would need a C-section, which will include preeclampsia, a breech presentation of the baby in the womb, a narrow pelvis, or fetal birth weight. They also claimed that having given birth in the hospital was more expensive. Next slide, please. These factors influenced the decisions made by pregnant women on their choice and place to give birth, whether they will agree to give birth by C-section or not. So now what must be done to move forward? Next slide, please. It is clear that the gap between perceptions, knowledge, and attitudes of women when it comes to C-section lies with the need to increase awareness among members of the society who influence decision of pregnant women when they are about to give birth. Husbands, mothers, religious leaders, traditional rulers, community influencers must be sensitized with proper information concerning C-section. Evidence from discussions with respondents in the research by the Giving Birth in Nigeria team pointed out the higher cost of C-sections compared to vaginal deliveries. Government hospitals should look to ensure that there is no significant cost differential between the C-section and the vaginal births. High-quality maternal care is the right of every Nigerian woman. The federal government must be deliberate about speeding up the disbursement of the Basic Health Care Provision Fund, BHCPF. Next slide, please. Next slide. The federal government must be deliberate about speeding up the disbursement of the Basic Health Care Provision Fund, BHCPF, to the states that have been embarked. State insurance schemes would also help to reduce the financial burden placed on women when giving birth, as maternal and child care should be adequately covered within the cost of the health insurance. This will provide soft cushioning for women and their families that lack available funds to undergo life-saving C-section if required. Next slide, please. So now we are moving to the second part of my webinar presentation, Midwifery in Nigeria. Midwives are health professionals specially trained to provide care for women during pregnancy, labor, and childbirth. Most people are familiar with this function, but less aware that they also have explained roles to provide care before pregnancy and beyond childbirth. A critical factor in the fight against maternal and child mortality. The unique nature of the midwifery care means that midwives can practice in a hospital setting, at the community level, or at home. The World Health Organization, WHO, has declared 2020 Year of Nurse and Midwife. Midwifery in Nigeria is largely dominated by women and faces issues of lack of recognition and adequate remuneration when compared to the entire health workforce. If Nigeria is to make adequate progress towards reducing maternal and child mortality, the role of the midwife must be given adequate attention. Next slide, please. The UNFA points out that the midwives can help prevention 2/3 of the maternal and neonatal deaths and deliver 87% of all essential sexual, reproductive, and maternal newborn health service. Data analyzed from 13 studies involving over 16,000 women revealed that women were reportedly happier with the care they receive from midwives if they have fewer epidurals, assisted births, and surgical incisions to reduce the risk of a tear. Finally, the midwife-led settings women were no more likely to have cesarean birth, but they tended to be in labor for about half an hour longer on average. Countries that invest in midwives have better maternal health indices. For instance, the Dutch midwifery system relies heavily on midwives with policies and systems to back up their practice. Midwives in Holland are totally autonomous. This system prevents midwives and obstetricians from behaving in ways that are bad for them. Other countries where midwives' roles are appreciated include the United Kingdom, New Zealand, and Australia. So it's time for Nigeria to invest in midwives. Next slide, please. In Nigeria, the voices of midwives are barely heard, and there seems to be little investment in the education of midwives and nurses. Investing in midwives is important to help reduce maternal and child mortality, but it also goes beyond that. It is a path to achieving universal health coverage, UHC, without leaving women behind. There have been successful maternal and child health interventions in Nigeria. One that's come in mind is the Bayero project in Ondo State. One important contributing factor was the state investment in midwives. In a conversation with a midwife who worked for primary health system, she emphasized the investment in continuous training of midwives, pointing out that this made them confident to carry out and give quality, competent care. Next slide, please. So the midwifery service scheme and the SHOAP MHC are other evidence to the successes of midwives in reducing maternal mortality in Nigeria. For Nigeria as a country to ensure that the status of midwives is recognized and the power of the workforce is harnessed to improve the health of women and children in the country, it must carry out one of the following or all, if possible. First, it must invest in midwifery education. This should not stop only at midwifery schools, but graduate education and capacity building should also be strengthened for midwives. Next slide, please. Second, it must improve the provision of water, sanitation, and hygiene wash facilities and good salaries, plus other allowances, also important to encourage the midwives and increase retention of midwives in Nigeria. Next slide, please. Third, strengthen the leadership and participation of midwives at decision-making level. Midwives stay longer with patients and understand their issues affecting women and children. It is important that they are not left out in program design, implementation, and policy decisions that affect the care of women and children in Nigeria. Next slide, please. Fourth, there must be address at the workplace of midwives, address on violence and protection in humanitarian settings. Next slide, please. So all these are pictures of the midwifery and the patients in the hospital settings in my country. Next slide, please. Next slide. This is the section of midwifery training, some intense in Ondo State. Next slide, please. The Ondo Midwifery Foundation, I was telling you earlier. This is section of midwifery in hospital settings. Next slide, please. more like a seminar concerning the IBA project in Ondo State. Next slide, please. I believe this is the last slide. With this, I've come to the end of my presentation. I thank everyone for listening. I'm grateful to be part of this team. I'm open to questions.
Unmute. Hi. Okay. Yeah. So questions. Yeah. If anybody has any questions, please put them in the chat or in the Q&A if that works. But I think the chat works well. So if you wanted to put any questions in the chat. Perhaps I could start if nobody else is recording anything. Wow, that was a great talk. So you're saying that midwives aren't invested in Nigeria as much as they should be. So where do most women give? But then your first part of your talk, you said that that they did traditional healers. So could you just explain to me? I'd really love to hear more about how most women give birth in Nigeria.
Yes, they give birth with the aid of traditional birth attendants.
Okay.
They are seen as healthy women of older. These traditional birth attendants they are called massagers. They assist the pregnant women. And the pregnant women are largely influenced by their relatives and their religious beliefs. They trust what their traditional leaders tell them rather than what the hospital or doctors advise.
Okay. So like a midwife would be somebody like a trained midwife. She would be trained in like Western medical or modern medical methods. But so she wouldn't be like a traditional birth attendant. So what you're advocating is that the Nigerian government put more money into training, into financing and training midwives.
Sure, they should invest in midwifery education. They should
Okay.
improve their workplace conditions. They
Okay.
should strengthen the leadership and participation of midwives, and they should address the workplace violence and protection in the humanitarian settings.
Wow, yeah, those sound like really good recommendations and really important recommendations. I know in the United States, we for a long time midwives were almost considered outdated. Like all through, it was physician assisted births. But then in the 70s, they started coming back, and now in the United States, you can choose to have a midwife, especially if you don't have a complicated birth. If you have a complicated birth, you need to see a physician. But if you have a normal birth, you can see a midwife. And so midwives are becoming increasingly popular in the United States. So
that sounds interesting.
Yeah, it is. It is good. As you say, it's more economical because
Yes, so also in New Zealand and Australia.
Yeah, exactly. Yeah, New Zealand and Australia, exactly. Yeah.
And Holland and even the Dutch. There are a lot of countries that invest in midwiferys to have better maternal health indices.
Yeah.
So that they can treat their patients at home or at the workplace.
Yeah. I think the United States is kind of behind the game a little bit in that, but they've started to use more midwives. But I don't think they're as advanced with the Netherlands, and in Australia where midwives I think are more prevalent. So now, are there obstetricians as well in Nigeria? There must be obstetricians as well in Nigeria. So is it right now there's a choice basically between a traditional birth attendant and an obstetrician that people have?
Yes, they are very much aware of what the cesarean section is and what the midwifery is, but they rather go to the midwife, the traditional birth attendants, than the hospital because they are more cheaper and less expensive.
Yeah, I can definitely see that. So in the United States, we actually have a problem with too many C-sections. Some people think C-sections are done too easily. Is that a concern for you? Do you think in Nigeria that there aren't enough C-sections, or that people should get more C-sections, or like what's your view on the prevalence of C-sections?
From my personal experience, my first delivery, I had what do you call it?
A C-section, a natural birth, or
no, I had a C-section
Oh,
from
yeah.
my first
Yeah.
delivery. I had placental previa.
Oh, yeah. So that was
So
good.
I
Yeah.
went to the hospital. It is an emergency situation that requires saving either my life or the babies, or losing both lives. So
Yeah,
I have to go
absolutely.
for the C-section,
Yeah.
and I lost the baby 7 hours after the
Oh,
surgery.
I'm so sorry,
Then
Aysha. I'm so sorry to hear that. I really am. That must have been
it's
really
okay.
sad.
Then
Yeah.
it's so sad in since it was my first baby. You know the
Yeah.
excitement how it would be,
I am
and afterwards, when delivering this little one, you saw me the other
Yeah,
time
your
with.
beautiful daughter. Yeah.
Yes, I delivered her via C-section as well,
Yeah.
because I was so scared due to my medical past history.
Yeah.
Not, uh, yes, trying to avoid anything that will deteriorate the health system of myself and the baby as well.
I can, I had twins actually. They're 22 now, so it was a while ago, but I had twins. And one of
Wow.
them was breech, so I had to have a C-section. Um, and for that one, it was like no question, I would have a C-section. And they were early because they were twins. They were 31 weeks, but it was, there was, they had neonatal intensive care unit, so they survived, and now they're graduating from college. But then 10 years later, I had a little girl, and now she's just turned 12. Um, and again, they said I could try to have the vaginal birth, but they said it would be safer to be a C-section. So I had a second C-section too, with her. Um, so yeah, I know what you mean. You want the baby to be safe, and so to go with a second C-section. I actually made the same choice. What's your daughter's name?
Yeah. Hayat or Hayati,
Hayat?
that's what we call.
Oh, that's lovely. She's so lovely. You're doing such important and valuable work, really helping. I study global history medicine, but you're really on the ground making a difference and stuff, it sounds like, and that's wonderful. Um,
Thank you.
so you do health education with people. Yeah, that's what do you think is your greatest challenge that you face in health education?
Mm, Sometimes at the community level, people are more concerned with their traditional beliefs. It will
Mm,
take you a tough time to convince someone about the modern world, the modernization, the
yeah.
insights and innovations in public health. It takes too much tough time for someone to welcome the idea of welcoming the insights and innovations in public health, the digital and telemedicine.
Yeah.
But the literates are welcoming it little by little.
Oh, that's good. That's good. That is really great. Um, do you think you're making any progress in getting more investment from the Nigerian government in health work? You mentioned that that midwives aren't always well paid. Do you feel like you're making any progress in getting more pay for midwives, or more like better health facilities?
In the private hospital settings, there are more facilities. It's well organized. There
Okay.
will be a hospital that you even think you've gone out overseas.
Yeah,
It's private.
I'm sorry, I didn't mean to interrupt. Oh yeah, I
It's
remember
okay.
yeah, I remember you said in your presentation that some people felt like the private hospitals had better care than the public hospitals.
Of course, they had better care than the public hospitals,
Yeah,
because you can't compare anything that is government owned.
yeah,
Say before the resources are channeled to the grassroots level, it will take time. There is counterpart coding. There are a
yeah,
lot of lack of budget allocation and their funding before the budget reach to the grassroots level. But if it's a private hospital setting, someone will organize it based on his test and based on his financial stability.
Mm. Are the private hospitals much more expensive than the government hospitals? Like, who can go to the private hospitals?
anyone can go, but if you want it to have a cheaper experience of the private hospital, you have to engage in the national insurance health scheme. That's when you have lesser discount, like 10% out
Okay.
of 100. That's what you are going to pay. The remaining will be reduced from your salary at
Okay.
work.
Oh, so it can be reduced. Okay. So is there, I don't know this. Is there national health insurance in Nigeria? Does everybody have health insurance, or do you have to buy health insurance? How does health insurance in Nigeria work?
Yes, it works. It
Yeah.
works if you are working with the government organizations and even with the international NGOs. It works a lot.
Okay.
Except if you didn't register for it.
Okay. So you have to register. So you have to register for health insurance. If you're not working, can you have health insurance, or do you have to be working at a job to get health insurance through your job?
That yes, if you are not working, that will be out of pocket payments.
Okay.
You pay out of your pockets.
So yeah, that's in the United States too. We get our health insurance through our jobs. I think it's but in Canada, like we live, we live very close to Canada here. And I'm on Northern New York, and in Canada, your health insurance is not through the job; it's through the government, and everybody has it, no matter what. And I think that's a better system because then if you lose your job, you still have your insurance. You see what I'm saying?
Yes, yes.
Yeah. But in Nigeria, it's like the
That's
United
it.
States. Yeah.
Yes, when you retire, you lose your insurance. You lose all the privileges and the benefit packages that comes along with your work, like the housing insurance,
Oh,
especially
wow.
if you are working with the international NGO, the health insurance, the life insurance, like when you are traveling,
Yeah.
whether by road or by air, there could be some danger like that, a road accident or a plane crash. So there is
Yeah.
a life insurance if you are working with an international NGO for your family,
You can have that.
because
Yeah.
you've gone for an official trip and you lose your life. So there will be a life insurance that will be given to your family.
Okay.
Some even give housing insurance.
Oh. Oh, that's good. That's good. But you don't, but only through your job. You can get this through your job. Ah,
Yes,
I
like
understand.
we
Yeah.
recently relocated to the capital city, Abuja, in Nigeria. So there are lots
Yeah.
of international NGOs here, though there are other branches in other states like the Kano I left and other states. But since it's a capital city, there will be a lot of organizations, institutions.
Wow. That is so fascinating. That is really fascinating. Um, so but can you, so does your insurance pay for the private hospital as well as the public hospital? Do insurances pay for the private hospital as well as the public hospital?
Yes,
Yeah.
it's paid for both the private and the public hospitals.
Okay. Ah, well that thank you so much. I'm looking to see if I don't see any other questions here for this, but I think people can we'll be able to see your presentation later. I know a lot of people are planning to watch, all the different presentations that they missed later. So I think people will be able to view your presentation later on through the oh wait, oh, wait, I'm not muted. Okay, yeah. We'll be able to see the presentation later on through the thing. So this will be, and you'll be able to see the other presentations too. So I'd just like to thank you very much. I have to go now. I have to go to the to open the room for the next presenter. But I was really excited about hearing your presentation. It's so wonderful to get to talk to somebody in Nigeria, somebody who's doing the kind of work that I read about all the time. So I really loved hearing what you had to say. And thank you very much. Can you, yeah. So thank you very much, Aysha.
It's a pleasure having to share my talk with this webinar.
Yeah.
I'm grateful.
Well, we're very grateful that you
It
agreed to
was a
come talk to
wonderful
us. Yeah, we're very grateful that you shared your work with us. It's really it was really
looking forward
wonderful. Yeah,
to
yeah,
having you on next.
yeah. I learned a lot, Aisha. So thank you so much. Okay, so I'm going to go to the next room now. So I'm going to end this session now. But thank you and have a wonderful day. Wait, one more thing. What time is it there? What time is it in Nigeria right now?
Past 7, quarter to 8 p.m.
8 p.m. It's 8 p.m. there. It's quarter to 3 now. So I guess 5 hours time difference. Okay. Okay. Thank you so much and have a wonderful day. Have a wonderful night.
You too.
Okay. Goodbye. Bye.
Bye bye.